Hello, everybody. Good afternoon. I'm your host, Marc of the Social Security Talk podcast. It's a beautiful day in Cincinnati, Ohio. Blue skies all around, and we're expecting blue skies for another 3 days and then a little bit of rain. But spring is here and summer is right around the corner. Anyway, that's enough to talk about the weather. Let's talk about Social Security software. Our guest today is Michael Daley. He is the Director of Marketing with HealthView Services. They've been around for about 17 years, and they are located in Danvers, that's Danvers with an S, Massachusetts. Michael, I've known you for about, I want to say 5 years, although I'm guessing a little bit.
Mm-hmm.
You've taken our class in Social Security Education, the National Social Security Advisor class. I'm glad.
Mm-hmm.
Thank you so much for doing that.
Mm-hmm.
And also, we talk about your software when we teach our classes. So, Michael, tell about who are you, first of all, and how did your company get involved with Social Security software?
Well, thank you for the introduction, Mark, and thank you for having me on the podcast. As you mentioned, I am a proud NSSA member, and for a few years now, I've had that license, and I still refer back to a lot of the resources you guys have put together. That helps me in my day-to-day job here at HealthView Services, which I'll give a little bit of a background on. I joined the company about 9 years ago in sort of more of an entry-level marketing role on the product marketing side specifically, looking to sort of get involved in the B2B SaaS world, not having any background in Social Security or anything like that, and they just so happened to need somebody who could help out with the Social Security software that they were at that point was pretty new. And I recall this when I was hired but hadn't yet started officially. They had me come in one day. I figured I'd be going in to sign some paperwork and do some of the formality stuff, but they handed me a big stack of Social Security books and said, "Hey, we need you to learn all this stuff." So I was eager, and I did.
Right?
Yeah, exactly.
Mm-hmm.
Drinking from the water hose, right? But I did learn a lot there, and of course, as you know, with this stuff, you learn something new every day as you do this. But what's interesting about our company is we started, of course, before I got there, as primarily a retirement healthcare cost data company, working with an actuary partner to produce personalized retirement healthcare cost projections for Medicare and supplemental insurance, out-of-pocket, stuff like that. And that went well for several years, but enough people were asking about Social Security, of course, related to Medicare in many ways. So, would you have any Social Security software? So they got to the point where it made sense, to invest in that. And the platform that we have includes both of those and also some long-term care. But in tying those together, one of the things that we focus on that a lot of other people I think are starting to catch on with as a really important thing is the Medicare withholdings out of your Social Security benefit. The Medicare Part B, by default, those premiums come out of your Social Security check. And if you're surcharged through that IRMA policy for your Medicare, those surcharges also come out of your Social Security check. So one of the nice things we have is that overlap between Medicare and Social Security. And we always show benefits from Social Security both before and after those Medicare withholdings.
Well, Michael, talk a little bit about the healthcare cost program that you have. How does that work, and what's the what are you looking for there? What's the objective?
So, I think people pretty largely realize and acknowledge that healthcare costs in retirement are going to be extremely significant for most people. One of the leading one of the leading expense, if not the leading expense, they'll face during their retirement years. But when you see a lot of organizations doing press releases or any publications talking about healthcare in retirement, they say, the average couple retiring today at 65 is going to spend X dollars on healthcare costs. Usually it's a big scary number too, but
Isn't it like $250,000 per person, or is it per couple?
Well, it depends on which way you look at it, which kind of leads into the point, which is you can look at it and say, if you took averages across the board and you look at it, you probably look, and most people say around that $300,000 for a couple.
For a couple, fine. Okay.
For a couple over there if they're currently 65. But what the data shows, and what we work on with our actuary partners to do, is to show there's a lot of variability there. There are factors that you need to know, like gender, health status, retirement age, State of residence, costs vary depending on where you live. Income, I just referenced those income-based surcharges for Medicare, right? Coverage, all of those factor into play. And what you end up having is, maybe the average person spends a couple spends 300,000, 400,000, but you are not an average, nor am I, nor is anybody else. So
I'm unique.
We're all unique, and you
Yeah.
really need to individualize those costs. And maybe it's only 100,000 for you, or 1 million, or whatever it may be. What you end up finding is when you have those data points, you see some interesting trends. Like the one thing that surprises people the most is if you compare somebody who's healthy, no chronic health conditions, takes good care of themselves, versus somebody who does have, say, type 2 diabetes, a chronic health condition that has a big impact on spending. You'll typically see, if all else is equal, you'll see that the person who's healthy with no chronic conditions actually spends more money on their retirement health care in total because they live longer and they have more years to fund. So we also include actuarial life expectancy projections, which I'm sure we'll get to. We do include in the Social Security analysis as well. But when you look at somebody's health, maybe on a year-to-year basis, they're spending less if they're in good health. Of course, that makes sense. Their out-of-pockets are lower. But over time, they're adding more and more years because they may be outliving a person with diabetes, for example, by 10 or 15 years. So it's just because someone's healthy and taking good care of themselves doesn't mean they don't have to worry about their retirement health care expenses.
Well, you brought up a good point, Michael. The healthier you are, the longer you live. And of course, as you live, during your later years in life, healthcare costs, come about.
Yep.
I know a married couple. Their ages are like 88 and 91, and now she just fell and hurt her hip and had some pins put in there. But now they have to have home care in the house. They weren't planning. They have long-term care insurance, which is great, but they weren't planning on it just 2 months ago. But about a month ago she fell, and now she's not able to cook, and now she also has to have people come in to the house, and that's a really difficult situation to be in.
It is, and a lot of people, like the couple you're referring to, they think that they plan for it. They have long-term care insurance, but one of the things that I've learned through our long-term care software and solutions and even the content that you're always reading about when it comes to LTC, it always bugs me that when you look at long-term care, like home care, which a lot of people prefer home care, they'd rather not go to a facility if ever possible. But when you look at cost estimates, they say, here's the cost. And when you read the fine print, you're typically going to see it say, this assumes 40 to 45 hours a week of home care needed. But for a lot of folks who do need that home care, unless they have somebody living with them who can provide care during nights and and weekends, stuff like that, a lot of people need more than that 40 hours. So a lot of times I see people underestimating future home health care costs because, I think everybody's experienced it with a parent or a grandparent or a loved one at some point. Those long-term care expenses, whether it's home care or in a facility like a nursing home or assisted living center, they're extraordinarily expensive. And the data shows that, the inflation, the anticipated inflation on these costs is not particularly low. It's not, the high costs are not going anywhere. So the more one can plan around that, certainly the better.
So is this a standalone software package? How do advisors use it?
So the package, the HVS portal, includes Social Security optimization platform, within it retirement healthcare cost projections, and long-term care cost projections as well. The way the system is built is you build out a client profile with sort of baseline questions you need to know across the board: date of birth, gender, name, basic stuff like that. And then as you get into each of the illustrations, whichever ones you might be interested in running on that particular day, it would ask a couple of follow-up questions that are exclusive to that particular illustration. Like, for example, primary insurance amount, or healthcare coverage, things that are specific to a certain topic. They would ask those and be able to run those illustrations. So,
how would somebody like myself use your software? Why would I use your software? So let me just say, Michael, I'm 67. I am on Social Security, turned it on back in June. So that's about 10 months ago. But I have not really looked at my long-term, my healthcare costs over the rest of my life. So how would somebody like myself utilize your software?
Yeah. So if you ran a Social Security analysis, we do allow the functionality for somebody who's already collecting their benefits. It would just show an illustration of future benefits. What we're
Yeah. Okay.
actually adding in 2023, Q2-ish, maybe Q3, is the ability to show, suspending benefits, which would be an option for somebody in your situation, and also sort of the inverse of that, which would be retroactive benefits. So even if you're already
Mm-hmm.
at your full retirement age, whether or not you've claimed, there is still some wiggle room there where you can maybe do some other things. So we do have that included in the software. Um,
Okay.
and then as far as your healthcare costs, yeah, we can project health expenses annually, and we'd ask questions about, health status, state of residence, and things like that. And then certainly long-term care, we would also be able to project. The interesting thing about that is long-term care expenses vary by state, as do healthcare expenses, but LTC also varies by metro region. So we even allow for specified cost projections within about 500 something metropolitan statistical areas. So you pick the state, and then you can do state average if you want, but otherwise you can narrow down into that metro region. What you see is it's usually a pretty expected trend where the places with higher demand or greater population density, they're going to have higher cost of living, are going to have higher costs. If you look at a state like California, you can see a pretty significant expense even within state lines. So that specificity there on the LTC, depending on where you may anticipate having those expenses, that really helps people get a better idea of what their future long-term care costs could be. And then they can determine, well, do I want to self-fund and invest and sort of earmark assets to specifically address long-term care costs should they happen later in life? And if they don't, I can leave that money to heirs. That's one
Mm-hmm.
option. Or, of course, they could say, well, maybe I need some insurance against this and I want to be able to cover X dollars in costs because that's what it would cost me for whatever, 2.5 years of nursing home care in the Sacramento area, whatever it may be. It allows you to look into that level of detail and help people be better prepared for one of the biggest variables when it comes to their retirement planning.
So through the HVS portal,
Mm-hmm.
advisors can utilize like 3 software packages: Social Security optimization, retirement healthcare projection, long-term care costs. Am I saying it right?
Yeah, no, you nailed it. And actually, there's a fourth
Okay.
that I didn't mention yet, which is a standalone tool for Medicare surcharges. We do integrate that at a more standard level into our healthcare and our Social Security analysis, but there is a more detailed standalone tool that if folks want to get into more detail on that IRMA, income-related monthly adjustment
Mm-hmm.
amount calculation, they can do that
Yes.
as well. So there's actually 4 tools in total.
Got it. So
Hmm.
let's talk about your Social Security tool.
Mm-hmm.
I assume it handles married uh, married couples.
Yeah.
It handles single folks,
Yep.
public employees,
Mm-hmm.
and like you said, it would also let you know if it makes sense to suspend benefits upon reaching full retirement age, or maybe try to go back and get a nice lump sum check. Also, you can go back 6 months if you're over your full retirement age.
Yeah.
Let me ask you, Michael. So, in kids, does it include an analysis for children
Yeah, it does. It
in
asks
case?
about dependent children. Yeah, exactly. If they're under 18,
Oh,
um, we would
okay.
ask, we would ask that as well, and then also show potential benefits for the other spouse, so the quote unquote young parent benefits as well, if
Mm-hmm.
applicable. So
Okay.
that and what we find a lot of times is it's more common than you think. In fact, our CEO is in that situation where he
Oh,
actually
kids, more
yeah,
common than you think.
yeah, the kids at that age are we see it in more cases, and our CEO always jokes whenever he does any of his speaking engagements and talks about Social Security. I'll say, actually, whenever I'm on the golf course, the guys give me a hard time because I'm currently getting 3 Social Security checks. One for me, he's of full retirement age. His wife, who's a little bit younger, and his daughter, who's high school age. So, we do allow for that functionality, and a lot of times that changes the optimization strategy. You may be better off filing as quick as possible and maxing out on those dependent child benefits, depending on
Mm-hmm.
the situation.
Yeah, I'm not sure what I would do, Michael, if I had a child under the age of 18 or 19. Or under the age of 16, because then you can get that child and care benefit. I'm glad my kids are over older than that, so I'm excited about that. Definitely. Michael, tell folks again how they can contact you to discuss your software in more detail?
Yeah, so you can reach us on our website, hvsfinancial.com. In the top right of the page, you'll see a link for the HVS portal to log in if you already have an account. But in this case, you probably would would register your account, which is the other link that you'd have at the top of the page there. You can also reach us through, if you click the contact us right below that, actually on our website, you can either fill out a form and submit any questions or anything like that, or right to the right, there's an email address and a phone number that you can call as well. So if you have any questions on the application's, abilities or anything like that, you can certainly do that. Part of the software package that included in the license fee is that you get ongoing support as well through an email support system as well as phone from Monday through Friday from 9 to 5. So a lot of folks, especially those new users, well, we also do one-on-one training with them. If you want to send us a fact finder with some client information, we can actually build out a report for you under your account and walk you through on a one-on-one meeting on a Zoom for half an hour and say, here's what you want to look for. Here's the important things about this case. Here's what this page does and what this number means, and get people familiarized with it. So a lot of folks take advantage of that part as well.
So can advisors purchase all four bundled and or individually?
So it's all included as a bundle.
As a bundle, got it.
Exactly, and which and again, the support standard. There's some marketing material in there and educational content as well. It's even mini tools like you want to do a more simple healthcare analysis. You put in someone's age and pick on this. There's a map of the country. Just pick on the state that you want, and to show you the cost in that state for a certain period of time. So more those little mini applications are also included as well, and that's sort of all bundled in there in that package.
So why did your company decide to put these four software tools together? Because I haven't come across this from any other company. So why did you want to do this?
It kind of happened organically, where, as I alluded to briefly earlier, was that it started off with just the healthcare side. People said, this is great. We love the healthcare cost projection, but, it doesn't include long-term care. What about end of life if you've got this nursing home need? And you said, okay, that's a good point, right? Here's a tool that does long-term care that can be integrated in very easily to the profiles that you're already building out on the tool. Oh, hey, by the way, this is great, but we like Social Security as well. I understand some of this Medicare cost actually comes out of my Social Security check, right?
Yeah, it does.
Right? Mm-hmm. There you go. And then typically for the Medicare surcharges, since our CEO has a background in financial services, so he's always privy to these sort of things, and before it was even more well known. This IRMA policy said, we really should be doing more about these Medicare surcharges because, just to be frank, a lot of folks who are working with financial professionals, they are typically higher earners, certainly higher than the national average, and not all of them are going to be impacted by income-based surcharges in retirement, but a lot of them will be, and
it will be.
Accounting for that in the projections is great. And again, we do it in our regular tools, but we have a specific tool that gets into even more detail with more of a year-by-year analysis if you want to, get into more detail and look at the income annually and compare the MAGI and all that fun stuff when it comes to IRMA. So again, it wasn't a plan to have all four of those in there, but as we've been adding more and more, getting more and more feedback from our clients and our associates in the industry, and it just sort of happened organically that way. And folks like to have that robust suite of tools at their fingertips. And some people may only use 3 out of the 4 of them typically, or 2 or whatever it may be, but they have those options there, and that's all included.
Do they work together? In other words, the information from, let's say, the retirement healthcare projection, does that work into the Social Security optimization tool?
Yep, it does. So the way that we do it is this is when we were designing this particular version of the tool, we had this big spreadsheet of all the inputs that we need for every illustration. And what we took was, where is the overlap, right? If you have a question that you need for all of them, like, for example, date of birth, of course, you need to know that across the board, then that goes into the client profile. So you only have to fill the person's date of birth one time. Then if you go to specifically, healthcare cost illustration, for example, that's where we'd be asking specific questions about healthcare that wouldn't affect your Social Security benefits, wouldn't affect your long-term care. Like, do you want dental insurance? Relevant to healthcare, but not to anything else. So that's where we would ask that question there. That way it minimizes the number of inputs. Nobody's inputting the same information over and over again. But it keeps everything clean and segmented, and they all have their own reports and their own information on there. But of course, there is overlap, and we make sure that nobody's...
Okay, because I always know that the biggest fear folks have, and one of my biggest fears is outliving my money.
Mhm.
And medical expenses are huge down the
Yeah,
road. I just know they are, and that definitely scares me.
it does.
And
It scares
that's
a lot of
why
people,
it's,
not just you.
yeah, go ahead. I'm listening.
I said it scares a lot of people, not just you.
Yeah, no, I realize that. Yeah, what's my default going to be down the road? Medicaid? I mean, the Medicaid program is going to be bursting at the seams in 10, 20, 30 years because everyone's going to be on it. As we live longer and longer, you're likely to be on Medicaid.
It's true, and a lot of people say, "Oh, that's oh yeah, I guess always go on Medicaid." And yes, that is there
Well,
for folks who need it, but it's not. It's not as easy as just calling up the government and say, "Hey, I want Medicaid, thanks, bye." There's a
uh-huh.
long process to it, and you've really got to be very low on assets and income
Well,
both to
I
qualify.
know, agree, but if you live long enough, you're going to be low on assets and
Eventually,
income.
yeah,
I
eventually,
know that. Yeah.
you definitely don't want to be in that situation. That's where of course, long term care is one of those biggest threats. Having a long term care insurance policy will protect against that and limit the impact. It's heartbreaking to see. We see it all the time, but and I'm sure you've seen it, and I think almost any financial professional has, where somebody does everything right their whole life. They save, they work hard, they make good money, and they do everything right. They retire at a reasonable age, and then they do everything until the very end when that long term care kicks in, and it drains them of their resources. Not to mention the time and the emotional burden on their family, but
Yeah.
they weren't able to leave any bequests behind for their heirs, and it's sad, but it's unfortunately tremendously common. And the more people can be made aware of that, hopefully the more that gets limited for the people who are doing it right and just catch a bad break near end of life, and it really affects their legacy, their
Well,
financial life.
I like your philosophy, your company's philosophy, Michael, to combine Social Security, retirement, healthcare costs, long-term care costs, and the Medicare surcharge. I think it just makes a whole lot of sense. It really does. Definitely.
Yeah, it
Michael,
really helps with those
is there
conversations.
like a is there like a sample report advisors can look at?
Yeah, like we have I can share one with you. We have a
Can you?
yeah, certainly. Give me one moment.
Do you have I'm not sure how to do that offhand. I know how to do that on Zoom and go to webinar, but not on
I should,
Riverside
yeah,
podcast platform.
it looks like there's a share button right here. So if you give me one moment, I can pull up an
I see
illustration.
it.
Yeah,
I guess it's going to work. Okay.
we're gonna find out together. In this report, of course, it's got a good a good chunk of it as the customized data that's going to reflect each individual case. It'll also have some sort of set information that that will always explain. Hey, here are the pros and cons of filing before or after your FRA, for example. So that's sort of supplemental information. Of course, the more familiar the financial professional is with Social Security, the easier it
Hmm.
is to do. But you don't have to be an expert. We want to make sure that those resources are there and available and easily understood. And I'm just going to pull up a random case here. Is this a good one to show? Sure. So, and let's first of all let's try and share the screen here and see if that works. Can you see the PDF here?
Yes, I can see it now.
All right.
Yes.
I'm gonna show a couple of things here. What one of the both the application itself, the user interface, the tool, and also the PDF always has three strategies: the earliest, the alternate, and the optimal. The earliest is going to be in red, line graphs, bar graphs, page headings, all that later on you'll see. An alternate, which is the one that the person can pick themselves, whatever they're considering for their filing strategy. In this case, it's just at their full retirement age. And then the optimal, which is the one that produces the greatest lifetime benefits. So we'll show annual, in a sort of a line graph form for visual learners there, and then lifetime totals, in a bar graph. We've also got where life expectancy is so imperative in what we do and how we handle Social Security, where really we don't believe that you can truly optimize without a personalized life expectancy. What we do is we show, well, this person or this couple used our health questionnaire, filled it out, and they got, you can kind of see here, a little bar, a little square here around this area. This is their actuarial longevity projection: 87 for him, 89 for her, a healthy male and healthy female. But of course, you could live to any life expectancy. That's the average, but half means there's a 50% chance you won't live as long, and a 50% chance you're going to live longer. People always ask, well, what if I live longer, my spouse lives shorter, or vice versa? This shows from 70 to 100 every life expectancy possibility. I know it's a lot to look at, but I'm focusing on it because it is so powerful. It has about 1,000 different benefit projections where you can see the trends where, well, if he lives to 73 and she lives to 79, that's a red dot. You know what? You're better filing as early as possible. What if he lives to 78 and she lives to 85? That's a blue dot. Maybe you should file your full retirement age. And you can see a whole bunch of area here for the optimal strategy of them both waiting until 70. Provides a lot of context around these numbers, and it shows that, how important life expectancy is in making sure you're getting the most out of your Social Security benefit.
Does this report also include the analysis of projected healthcare costs?
So what this report will show is it will show total annual benefits, and it will also show net benefits after Medicare withholdings.
Got it.
In this case, this particular couple, that would include their Medicare Part B premiums. I don't believe this particular couple is surcharged for their Medicare, but if they were, it would be included. So they're going to see total annual benefits here, and then they're going to see the net after their Medicare is withheld. And, what happens is Medicare Part B premiums go up by about 5-6% a year. I don't got to tell you. I know last year PACLB has been an exception, but Social Security COLAs typically aren't going up that high. Historically they're going to go up 3%. Recently, maybe closer to 2.5%. That over time you get more and more being taken out to cover those Medicare premiums, and you can kind of see that in the illustration there. So, for each of the strategies, we say what's happening and when, who's filing at what age and what month, how much are they getting, how do you apply, some helpful links, and then a full breakdown of all the benefits. And we have that.
Perfect. That's what advisors need to know, and that's what their clients need to see. There's no doubt about it.
Absolutely.
76 million baby boomers are out there, Michael.
Oh, boy. Yep.
So many people make mistakes, so they have no clue what their Social Security strategies are. They just don't know. That's
true.
why we educate, and that's why you offer this software. Definitely. Michael, we're running out of time. Again, please provide your contact info or how folks can find out more about the HVS portal and the applicable software.
Yep, you can go to hvsfinancial.com, and you can at the top right of that screen there of our website, you'll see the ability to register for your account with the HVS portal, and then you'll also see right below that the contact us field where you can ask any questions you might have, call that number, or enter submit a question there in the question field, and we'll be back to you in 24 hours.
Perfect. Michael, I really enjoyed today's Social Security Talk podcast, and I think your company is taking a novel approach to folks by combining the 4 tools together: Social Security optimization, retirement healthcare projections, long-term care costs, and Medicare surcharge. I don't know of any other company that has combined those 4 types of costs all in one. So I'm really glad that you guys did that. Michael,
thank you.
Any final comments you'd like to make?
No, I appreciate the time, Mark. As I said before, and I'll say it again. You guys do an excellent job there, you and Jim. And as I said, I wasn't just saying it because I'm on the air here. I use your resources all the time, and it's extremely helpful. So you guys have a nice community here for a lot of folks who are really carrying the torch of Social Security optimization and understanding here, and helping people better prepare themselves for one of the most important decisions they're going to make when they approach their retirement. So keep up the great work.
And as you know, we offer support. Anytime you have questions, Michael, don't hesitate to give me a call or send me a quick email.
I never do. Thank you.
Yeah, which is great. So thank you, Michael. Appreciate you being on today's webinar. Michael's with HealthView Services. And like he indicated, you can go to the HVS portal and find out more about their software, which combines social security optimization, retirement healthcare projections, long-term care costs, and that agonizing IRMA Medicare surcharge.
Yep.
So this now ends today's episode of Social Security Talk. Bye, everybody. Thank you again, Michael.
Thanks, Mark. Have a good one.